Yeah, we just want to highlight the threat that antimicrobial resistance poses, really, and it is one of the largest public health threats that is predicted over the next few decades, and it's a slow-burning kind of pandemic, really, of increasing resistance to antibiotics, which are antibiotics allow us to undertake so many kinds of treatment in medicine, be it safety when you're having an operation, to protect us when we're having chemotherapy or a transplant, when you're having intensive care. So they provide a safety net to keep us healthy, and at the minute they're under threat. So we want to use this week to highlight both internally to our prescribers and also externally to the public about antimicrobial resistance and why, for instance, when they go and see their general practitioner, the general practitioner may, with a cough or a cold, may not give them antibiotics. And that's because in certain infections, viral infections, antibiotics will not work. And if we use an antibiotic when it's not needed, we will only increase the risk of resistant bacteria, which could pose a problem in the future for them and for others as well.
When certain bacteria grow resistant to antibiotics, is that it for that antibiotic, or can the tide be turned back in the long term?
So a broad spectrum antibiotic will treat a huge range of bacteria, and because it treats so many, it promotes resistance occurring. So if you use a narrow spectrum, more targeted antibiotic, then actually on a population level, you don't promote the spread of mutation or the development of mutations or promote the emergence of resistant mutants within that population. So by controlling your antibiotics, you can reverse the trends in terms of resistance in antibiotics. So we've seen that locally with some of the work that we've done over the past 10 years. We've seen resistance in some antibiotic combinations drop slightly over the course of time, and that may be because we've controlled our antibiotics better in that way. We changed which antibiotics we use. But yeah, so that really is the way that we would do it, by controlling use of antibiotics. And the work that the laboratory team is absolutely crucial for that, because without the results that they generate, we would be blind as to which antibiotics work, which antibiotics do not work.
So we work behind the scenes all around the lab, but in this section in particular, we are testing different bugs, bacteria, parasites, fungi, and we get different samples, we grow them, and we then see whether it's significant or not. And we set up antibiotics in order to ensure that the patients are treated correctly.
And the idea is that you want to be aware what particular bacteria are growing resistance to certain antibiotics. Is that correct?
Yes, definitely. It's very important for us to see a trend in maybe the way that the different antibiotics of the sensitivities are changing. We have noticed a trend in having to use, instead of our first line antibiotics, different stronger antibiotics, because there's more resistance to the bacteria circulating. So yeah, it's been quite interesting to see the change in the trend.
Now, you're measuring the local circumstances against the backdrop of global patterns in broad terms. How does Gibraltar compare in certain resistances?
I think so far we're still on the low side of resistances, but unfortunately it is the case that we are seeing more and more numbers